A data leak from the BC Centre for Disease Control obtained by the Vancouver Sun last week shows the province has been withholding more granular COVID-19 data from the public. The province is facing criticism for this. Dr. Bonnie Henry on Friday said they're trying to achieve balance and avoid stigmatizing certain communities.
People always want more unless you're the one that's potentially at risk. And so we do have to find that balance. That's part of our job in public health.
Absent throughout this saga is Health Minister Adrian Dix and Premier John Horgan, actual elected officials. Dix postponed a press conference on Friday, leaving Dr. Henry and Dr. Reka Gustafson to defend the province's choice to withhold data. One public policy expert suggests that it would help public trust if Dix spoke to this directly.
So I think if we think about this moment as one where we want to try and actually maintain rapport and build trust, having Adrian Dix come out and answer those questions, I think would be really helpful. So I think we can think of a whole host of questions that we might want to ask the political figures involved. The people like Dr. Henry or Dr. Gustafson actually don't really have the jurisdiction to be able to answer.
KPU political science professor Dr. Ross Michael Pink imagines the government is planning their response.
They will be looking at the polls to see what the public feels and thinks, and that's partly the calculus that's going on right now. If you want to look at it in purely political terms, the general goal of the government of BC is to try to keep things calm and not inflame attitudes or feelings vis-a-vis any particular group in BC.
In part, the data reveal details of COVID-19 case counts and vaccinations at the neighborhood level, which for months reporters and researchers have asked for.
To play devil's advocate, aren't we entitled to more granular data as citizens?
Well, you are, yes, but not in every single situation, because every situation is going to be different. Yes, we all have rights, we all have privacy rights, but the government is also trying to recognize that there are also public responsibilities. And one of those responsibilities that we don't want to see any particular ethnic group be unfairly criticized and then become the subject of discrimination and even violence.
UBC's Heidi Turek says the meaning of data transparency evolved as the pandemic continued.
That privacy concerns actually are legitimate because there are real concerns around stigmatization if you can identify people. But by the time we were getting to hundreds and hundreds of cases a day, what mattered was what are the patterns of how we're seeing this. And at that point, greater data transparency, I think, took on a different meaning than when we were talking about 10 cases a day.
The next provincial health briefing with Dr. Henry and Minister Dix is on Monday at 3 p.m. In Vancouver, Kier Junos, City News.